Good morning at 5:45. We are starting a new series for you here on Daybreak. The first Monday of every month, we are highlighting and bringing awareness to a specific disease or condition. And we're teaming up with Community Health Works in Macon to bring you these segments. The month of February is Heart Disease Awareness Month. Chris Kiker stopped in our studio to talk about what heart disease looks like and how you can fight against it.
Well, heart disease is the leading cause of death here in the United States. 1 out of every 3 deaths is caused from heart disease or stroke. Not only is it a leading cause of death, it's a leading cause of disability, which that impacts not only the healthcare system financially, but also the labor force.
So this month being Heart Disease Awareness Month, I guess we'll start with what are some of the risk factors, things that people can look out for, and some of the things that happen to people.
Well, there's really 2 types of risk factors. You have your non-modifiable risk factors, which are things that you can't change. And that's your age, your gender, and then your family history. And then we get into our modifiable risk factors, and those are things that you can change. That's your high blood pressure, high glucose, high cholesterol, your tobacco use, obesity, and just leading an inactive lifestyle.
Okay. So with this month, raising awareness, Community Health Works, you guys help raise awareness. You do a lot of things. What are you doing, and what are some of the things that people can do, and I guess really bring it home to making sure that you are staying safe and staying healthy?
I guess the biggest thing is to get out and get active. We recommend 30 minutes of exercise or physical activity 5 days a week. And just here locally, there's a thing starting this week called Walk Georgia, and that's sponsored by the Georgia Extension Agency. Here locally, you can get your team of 4 family members, friends, or coworkers. Join a team, start a team, name it a cool name. And then you can get out and you log your hours, log your activity hours, and you compete against other teams around the region.
Pretty cool.
So, yeah, it's a really cool way to get involved.
And then what about eating healthy? I mean, obviously, everybody hears about eat your fruits and vegetables. What are some ways that people, I don't know, people might not like fruits and vegetables, or they might just have never tried it before. Some tips to get them to start eating healthy. I mean, you say heart disease is, this factor that people have to be worried about and conscious of. Some ways that, hey, this is really important.
Well, food is your best medication. You eat at least 3 times a day, hopefully, and we recommend eating a large diet of fresh fruits and vegetables. Here locally, there's tons of places you can do that and purchase fresh fruits and vegetables. We run a farmer's market on Wednesdays from 4 to 7 on Mulberry Street, and we have local farmers that bring their produce and for consumers and local citizens to buy.
And then what about tobacco use? You're talking about smoking, and again, we hear all these stories and things about how important it is to stop smoking.
Well, we encourage people to know their ABCs. A is to know, ask your doctor if you should take an aspirin daily. Number 2 is find out if you have high blood pressure or high cholesterol, and then get treatment for that. And then the last thing is tobacco and smoking. That's the S. And if you smoke, we encourage you to quit. Georgia has a tobacco quit line. It's 1-877-270-STOP, and call that number if you're interested in stopping smoking and finding help for smoking cessation classes.
And of course, you should always consult your doctor if you have any health concerns or questions. But to learn more from Community Health Works and what they do, just visit them at chwg.org.